Hello and welcome. My name is Chris from ChristopherHole.com and welcome to this video where we're going to be talking about compartment syndrome. We're going to do it in a few parts. We're going to talk about what it is, talk about some symptoms, we're going to talk about some potential treatment. Now, as I've mentioned before in a lot of these injury videos, this video its purpose isn't to diagnose or to help you self-diagnose a potential problem that you've got. It's to help you understand your anatomy better and also help you to understand some potential avenues of treatment and help you navigate that rehabilitation process. So when you do go and see another professional who is treating or diagnosing the problem, you'll have a better understanding of what they're talking about and what could potentially happen to you in that rehabilitation phase. So we will start with what it is. Now, how it's explained, compartment syndrome is quite simple. So it's when a muscle becomes too big for the fascia that surrounds it. So if you can see on this diagram here, you've got red muscles, you've got yellow bones here and here, and then you've got this white stuff in between. Now the white stuff is the fascia. Now you can imagine a muscle, and then imagine you've got like cling film wrapped around it. Now the cling film is the fascia. Now when the muscle becomes swollen, that could be through inflammation, it becomes too big for the cling film that's surrounding it, and it's the compartment that surrounds the muscle that then starts to not herniate, but it pushes on it and creates pain. So symptoms or typical symptoms might be sharp pain in the muscle, weakness, pallor, sensory loss or lack of pulse, swelling and tenderness, pain during exercise, difficulty in plantar and or dorsiflexion. So that's where your toes come up or toes come down. Now, for potential treatment, you might start to think about potential biomechanical correction, because you may have a dysfunction there, so correct biomechanical dysfunction. Then you've got longitudinal and cross-fiber massage on muscle. So longitudinal means massaging up with the grain of the muscle, if you will, and then cross-fiber basically going across the grain of the fiber. So if you can imagine a piece of wood, the grain goes up and down, your muscles are relatively the same as that. So you're looking to go up with the muscle fibers, but then also across it, and then that can just help relieve any tension or inflammation that's in the muscle that's causing it to push out on the fascia. But what you will need to realize is that it shouldn't be too painful too soon. I'm not saying that it won't be painful, because it is a tender area on the body, but you don't want to be going in 100% from the first second. You want to warm it up, you want to build up, you want to create some blood flow, and then you can start going in a little bit harder. You might think about myofascial release techniques and any soft tissue release techniques for tibialis anterior. So I'll allow you to sort of educate yourself on myofascial release and soft tissue release, because again they can take some time to explain. But hopefully this has been helpful. Just a quick recap. Compartment syndrome is when a muscle becomes too big for the fascia surrounds it. So fascia is like the cling film, and then the muscle compresses and pushes out on that. Symptoms: sharp pain in muscle, swelling and tenderness, difficulty during exercise. Then you've got any treatment, so correcting any biomechanical dysfunction, which could be overpronation, longitudinal and cross-fiber massage, and then myofascial and soft tissue release techniques. So hopefully this has been helpful. My name is Chris from ChristopherHole.com. I'll speak to you in a future video.